So I want to meet some of you and invite all of you. If you have not become a member of the American Association of Blacks in Higher Ed, it's a wonderful organization. And we will drop a link in the chat to share with you just how you can get involved beyond this webinar. What we have planned for you this afternoon is amazing. It's going to be enriching, and I hope it will shed some light on some of the things that that you come to find, that you came here to find out information on, and probably some things that you didn't even know were going to be shared. We want to certainly thank you for joining us, but we also want you to continue to be with us. And so you can see on your screen some of the signature programs that we have here with AABHE. Our Leadership and Mentoring Institute is an opportunity for professional development. Our annual conference, although it has been virtual the last couple of years, it has still been phenomenal. And we are looking forward to 2023 when we will return to San Diego for our in-person conference. We have a wonderful career center with job postings and opportunities for you to find employment and to find employees. Tons of opportunities for you to get engaged with the American Association of Blacks in Higher Education. And so stick with us. I also want to thank Dr. Howard Baptiste and the University of Tennessee, Chattanooga for providing the platform for this webinar. Her campus has been very generous to our organization, and we want to thank you again, Dr. Baptiste, Howard Baptiste, for all the work that you do. And so I turn it back over to you.
Thank you so much. And we here at the University of Tennessee at Chattanooga certainly reflect and present the opportunity to share this, to connect with our campuses across the nation today. And so thank you, Derek. At this time, we'll start to provide a little bit of background information about our presentation today. My name is Shawani Howard Baptiste. I serve as the Vice Provost for Academic Outreach here at the University of Tennessee at Chattanooga, and we're joined by our two moderators, Dr. Joseph Silver and Mr. Donald Murphy. So we are really excited about this opportunity today. Just a couple of house rules. Please make sure your mics are muted during the presentation. We are going to utilize the chat feature if you have any questions. So we have multiple people monitoring the chat to make sure that we capture your questions, and we'll be able to present those questions to our moderators at the end of our session today. And again, the golden rule always rules. So if you have any questions, let us know in the chat, and we are excited to go ahead and get started. So again, navigating higher education in the midst of the continuing COVID environment. So at this time, we'll turn it over to our featured moderators, Dr. Silver and Mr. Murphy.
Thank you very much, Dr. Baptiste Howard. We are delighted to come to you today to share a few of our thoughts on this very timely subject. Last year, we did a series of webinars on the impact of the pandemic on higher education. We looked at higher education finances. We looked at higher education and accreditation in the pandemic. And so now we find ourselves coming back fall 21, and the pandemic is still upon us. So the association is bringing this webinar to you, again, free of charge, Navigating Higher Education in the Midst of the Pandemic, COVID-19 Environment. I'm Joseph Silver, and I have the pleasure of serving as president of Silver & Associates, and many of the folk on this screen we have worked with and assisted. I'm very delighted to have as a co-presenter today a young man that I've known for years and worked with for years, and tried to convince him to come on and be a part of this webinar today was very easy. And that's no other than Mr. Don Murphy, who is CEO of the Wesley Peachtree Group. So Don, why don't you introduce yourself and say a little bit about your firm, and then we'll get right into the midst of this presentation.
Well, thank you, Dr. Silver, and it's indeed a pleasure and an honor to be by your side, shall I say, because there's no question you come very highly regarded in this business of higher education. And it's so good to see all of you who are joining us today for a timely topic. And hopefully, as we go through it, you'll get a lot out of it. And certainly feel free to ask whatever questions or whatever's on your heart or mind to either one of us. a little bit about the Wesley Peachtree Group. I'm the CEO and the managing associate of this firm. We're the largest minority-owned CPA firm in the southeastern part of the U.S. that specializes in higher education services, with a particular emphasis of serving HBCUs. Over the years, we've probably been on just about all HBCU campuses. We've worked with well over half of them over the years, and we audit more HBCUs than any other CPA firm in the country. So that's a nice distinction. Our motto has been to serve, and this unique set of clients, not just HBCUs, but also PWIs as well that we serve, but mostly HBCUs. And it's just been a distinct honor and pleasure to contribute and work with these institutions in the capacity that we do. So that's a little bit about our firm. I'll kick it back to you, Dr. Silver.
Thank you. We have a desire today to bring you some information on reentering and navigating higher education in the midst of this continuance pandemic. We're going to start out with just kind of giving you some updates on some of the numbers, and then we're going to talk about what did the campuses experience last year, and from there we're going to talk about things that you should be thinking about as you're opening up in this environment. And then what we want to talk about toward the end is, what has been and what will be the financial impact of reopening in the midst of this pandemic. And then finally, we want to talk about, just questioning, opening it up to each of you. So we're gonna focus in on the numbers first, and then we're going to ask you if you have questions to raise your hand. We have somebody monitoring the chat. We will have enough time at the end for question and answers. But if you have a burning question while either one of us is talking, feel free to ask that question and we can respond. One of the quotes that I used last year that I want to start off again today is with this whole concept of we cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic. And I think that speaks loudly. What we have seen is a spread of the pandemic across the world. And it has impacted not only higher education, but it has impacted the supply chain. It's impacted the way we do business, the interstate and intrastate commerce, and how we interact with each other as a group. I was thinking, because I haven't been traveling that much. I have, in the last month or so, I did travel to 2 trusted clients, and we had discussions about what that travel would look like and what they would do once I got there. And I can say in both cases, they adhered to the protocol very, very well. We had a very productive meeting on FAMU's campus, looking at budgets and how do you move forward in the midst of all these challenges. And I just want to applaud them, because the protocol they use in terms of a big auditorium, everybody had masks, everybody was vaccinated, and of course the podium was away from everybody. And most recently, I had an opportunity to travel to the Bahamas, to the University of the Bahamas, and the protocol entering the country was extremely tight. Even though I was double vaccinated, I still had to have a test before I got in and a test before I left. And I was thinking in an empirical way, what are the changes? What do I have in my briefcase now that I didn't have when I traveled prior to the pandemic? Some of you may can see this, but this is a mini bottle of Lysol. This is a bottle of sanitizer. And this is, these are wipes. And you got the Clorox wipes and the other wipes. I didn't have these in my briefcase before the pandemic. And now I was so busy trying to get those things in my briefcase that I left my power card when I went across the country. And so I had to get a power card when I got there, but I was so focused on making sure that I had these things related to health and to make sure that I was going to be safe that I inadvertently left my power card. Let's look at some of the numbers. When we began to look at the onset of this pandemic, we know that from a political standpoint, we started from behind because there were those in powerful positions saying that the virus was not even real. And as a result of that, the politics got in the way. And as a result of the politics getting in the way, the deaths occurred, the number of cases occurred. So when we talked last year in March, the first case was reported in February 2020. And by March 2020, there were over 1.7 million cases and 102 deaths, 102,000 deaths. In the United States in March of 2020 and September of 2020, there were over 40,000 deaths. And the first number I gave you was worldwide. In the United States, there were about 490,000 cases with 18,000 deaths. And by May 2021, and this is May 2021, over 900,000 deaths has been reported in the United States due to COVID, and 7 million worldwide. So one of the things we see is a discrepancy in the numbers because the World Health Organization is saying worldwide there's only been 688,000 and 42 million cases. But another study from the University of Washington Institute of Health Matrix and Evaluation said the number is more like 900,000. And a more recent statistics reported by the Washington Post said that 1 in 500 Americans have died from COVID since it began. And so, you know, I could ask the question, and I'm not going to ask you to do this, but just think as I ask this question, you know, how many of us on this screen today have had friends or family members impacted by this COVID environment? We have deaths around us. We have deaths within our families. We have had deaths in our community. We've lost giants of people who have suffered from this environment in terms of the COVID environment. And so as we began to look at where we are now, we began to see that there's about 119,000 new cases per day in the United States and about 2,000 deaths per day. And so it's already been shown that COVID is the deadliest outbreak in American history. So it has already surpassed the Spanish flu and what have you. And so it's kind of interesting that when we look at the highest incidence of cases in the United States proper, we see states like Alabama, Florida, South Carolina, Alaska, West Virginia, Georgia, Oklahoma, Texas, Mississippi, Tennessee, Louisiana. These are the highest deaths per 100,000 people. And it's kind of interesting that when you look at these states and look at the politics that are going on in these states, there's a correlation. And what we are seeing is that people have begun to play, from the very beginning, play politics with this virus. And so now 90% of the hospitalizations are folk who are unvaccinated. And 95+% of the deaths from COVID are unvaccinated persons. And so what we see now is a tale of two cities as it relates to the vaccinated and the unvaccinated. And the crime in all of this, and I'm going to call it a crime, is that those folk who are espousing the politics of the personal view or my private rights, you can't infringe upon my private rights to make me get vaccinated. Many of them are vaccinated. It's been proven, it's been tested, they're vaccinated, but they're talking to a large segment of individuals who believe the conspiracy theory and they are not getting vaccinated. So now we're seeing people on their deathbed saying, I wish that I was vaccinated, please. So what we are seeing now is the virus has become so political that it has become a red state, blue state issue. You can break it down in terms of political parties, who's being vaccinated, who's not being vaccinated. And so how does that relate to higher education? We wanted to have a discussion on the impact in terms of what campuses are experiencing last year, what they are experiencing as they reopen, and what we have learned going forward. I'm going to say a few comments, and I'm going to kick it over to Mr. Murphy to make some preliminary comments that he's seen from last year from a financial impact. And then we'll go into more of a discussion about what we're seeing. Last year, I was able to be on this platform once or twice and made several predictions and end up writing a book on this. The book was called Pandemic Public Health, Race, and Class, that received a lot of good ink and a lot of good feedback. But one of the things that we were talking about was that this whole unpreparedness of trying to respond to this pandemic would create havoc in terms of the resources that campuses had. We had to leave campus in the spur of a moment in March when people were on spring break, and many of the students had no place to go. We had situations where faculty members were asked to teach online and they had no online experience. We had situations where auxiliary services were brought to a halt, and as a result of that, additional finance that would normally be on the table was not on the table. And as a result of that, institutions really faced some very difficult decisions as it relates to finance and as it relates to how they were going to operate on a online platform when in many cases the technology just was not there for them to move forward. And so as a result of that, it was really a disruption, if you will, in the way we did higher education. There was a whole discussion about seat time and what does that mean? And the digital divide became very, very clear. But one of the big pieces had to do with finances. And luckily there was a lifeline. So I'm going to ask Mr. Murphy if he would kind of chime in and talk about what he saw on the fiscal side as it related to the finances, and then what was the lifeline that really got some of these institutions through. And then I'm going to come back and talk about some of the salient issues that we're facing even today. Mr. Murphy.
Yeah, absolutely. Thank you, Dr. Silver. Yeah, there's no question that when the pandemic first hit our campuses, there's no question there was chaos, there was just confusion, and there was a lot of uncertainty during that time. You recall even the overall economy of the U.S. Took a nosedive. So there was a lot of uncertainty there, and thank God that we had some provisions that came underway rather quickly through the efforts of Congress of this prior administration. We got a first round of funding back in March. As you know, we had the Paycheck Protection Program that came out, as part of the first stimulus funding, I call it, for this under this pandemic. And that was used by a lot of institutions who had 500 or fewer employees, but that was, I would say, a vast majority of the colleges and universities around the country that were able to participate in that round of funding. As you know, the Paycheck Protection Program was a forgivable loan as long as you followed certain procedures and rules. And so, and most of those who did participate did indeed get their loans forgiven. And then we had a part of that first round of funding, what we called HERF 1 funding, or Higher Education Emergency Relief Fund, that provided essentially three pots of money. One pot of money was designated for students due to the campus disruption caused by the pandemic. And the other part was for institutions. And this applied to all institutions, including MSIs and HBCUs and so forth, tribal colleges as well. And so with that with that funding, we also got a special set aside for HBCUs and minority serving institutions. So that was the beginning of the lifeline, if you will, to the institutions. And did it come at the right time? And it certainly did. And then, of course, fast forward to December, we had another round of funding, what we call HERF2 funding, same as HERF1, but a different budget and a different amount of funds that were divvied up among institutions. Again, 2 parts or 3 parts, institutions, students, and then for HBCUs, MSIs. And then also with that particular funding in December of 2020, a number of institutions who participated in the capital financing program for HBCUs, those loans were forgiven. So that brought about a huge and immediate impact on the financial condition of our schools, HBCUs, who participated in that program. And then, of course, recently with the Biden administration, with the funding, the HERF3 funding that came from that legislation. So as I said, those funds were designed to help institutions to pivot towards the distance education as a result of the pandemic, and to address the additional costs associated with the pandemic, keeping the campus clean and all of the other stuff associated with what we know from the CDC, social distancing, et cetera, retrofitting, and even loss of revenue. That was a great addition, if you will, to the funding eligibility for that program. So that you know, in fact, some of the schools we've been working with are currently trying to figure out how do they spend all of this money, because it was a fair amount of money. And one can argue that whether it was enough, but it certainly came at a good time. A number of the schools we serve actually, you know, in terms of the loss of tuition and fee revenues as a result of the students going home and some not coming back the following semester, this money, institutions were able to claim lost revenues and get reimbursed for that lost amount of revenues. Also, what you've seen in the news cycles, I guess starting over the summer or close to the end of the last semester, where institutions were basically wiping out the bills that the students owed the institution. Well, that was a great PR implication and certainly goodwill created for the students, but the source of that funding was actually from this program, the HERF programs. So it's been very beneficial for our institutions. And I think that there's more that can be done with that. Certainly, this is a time where institutions can re-examine themselves and determine what things they should be doing with this money that lends to sustainability. Because I'm afraid that with this virus, it's going to be here a while. So we got to learn to adjust and cope with it. And what are some of the best practices associated with that? Pivot to online, and of course, more so now, many institutions are doing a hybrid sort of model where they have on-campus classes and then they have stuff online as well. So this is an opportunity for those who haven't had a robust online program to start looking into that if you haven't already. But those are some of the things in addition to the increase in funding that many of us witnessed in our fundraising with the George Floyd situation that came up, and the guilt money that came from corporate America, if you will, that started pouring in. In fact, I was talking to someone at the UNCF. The funding there, I think, tripled over during the course of the pandemic. So that was a nice windfall for UNCF member institutions, and certainly how those monies can be used to help strengthen these schools.
Yeah, thank you, Mr. Murphy.
Yeah.
I think that it could be said that but for some of this federal funding that you just talked about, some of our institutions would have been in dire shape because we had predicted that there would be a financial impact. We didn't know the gravity of that impact,
Yes.
but some of the institutions who were on the verge, if you will, had these resources as an inflow, and it allowed them to balance budgets and to do some other things. And so one of the things that I think we should encourage institutions to do going forward is to begin planning now, because those funds aren't going to be something that's going to be coming in indefinitely. So now that you've gotten the debt paid for students, now that you got your infrastructure paid, now that you got these huge loans forgiven, you know, what are you going to do differently to make sure you don't get back into those same situations? So we talked about last year on the onset of the virus that we felt that this would have an impact on enrollment. Of course, that was our best guesstimate. But now that we've been through this for about a year or more, we know that the COVID environment has impacted enrollment. Overall, it's been about a 5.9% drop in enrollment. Also, in terms of community colleges, it's been about 11.3%. And we see that if you break those numbers down according to race and gender, it's even more revealing. There's some information that has been put out by the National Student Clearinghouse Research Center that spoke to the fact that this one-year decline has been like no other set of years that we've had in the last 5 to 10 years. There was stable enrollment over the last 4 years prior to the pandemic, and now we're seeing a decline, if you will. We're seeing that 2.5 million students who were freshmen in fall of 2019 did not return to the college. And that's almost a 20% change. And that's when you began to look at that in terms of factoring in the retention rate, you're going down from about a 66.2% from 67%. So it has had an impact, and these numbers are going to continue to drop unless something drastically happens. Now, we're talking about revenue. One of the things I've been looking at is, especially for state-supported schools, is the decrease in revenue from state sources. The higher education budget as a percentage of state budgets have been decreasing for the last 15 years or more. But it's decreasing even more during the pandemic because a lot of those resources have been supplanted because of the federal funds. And so states are diverting their funding to healthcare and other issues. And so the question becomes, when this is over, if it gets over, will those funds be restored back to these institutions? And from what I understand, during my days at the systems level, once that money is gone, it's hard to get back. And so I think that's going to be a prevalent question going forward. The other thing that we're finding in the return to the campus is, again, the politics of the virus. And you have systems like the University System of Georgia, for an example, who has a strong governing board. They could flip a switch and say, these will be the policies that the system will have going forward. But instead, because I think that they are playing politics, they're saying, we're going to let that decision be a local decision in the 30+ institutions that we have. So every president or every campus can make their own decision as to how they're going to respond as it relates to vaccinations, as it relates to mask or no mask. And so now you have situations where faculty members are having to make a hard choice, especially those who have returned to campus in an environment where you're giving students an option to mask up or not. They're trying to determine whether or not it's going to be in their best interest to continue teaching by putting themselves at risk because of the politics of these masks. It has already been determined that the vaccination works. And if you look at the hospitalization now at the 90+% rates and the death rates at 95% being the unvaccinated, it's not even about a debate about red or blue. It's about what the science is showing us. And this has a tremendous impact on higher education, because many of the folk who are in higher education, present company excluded, still have children in the public schools. And so they are in the public schools, and many of the public schools have opened with no mask mandate, no vaccination mandates, and immediately had to close because of the number of cases that were shown in that short amount of time. So one of the things that we see now that higher education is really have to factor in is the health and safety issue, not only of the students, but the faculty, the staff, and administration. And depending upon, you saw those states that we put on the screen when we first started out in Georgia, Florida, Louisiana, and what have you. If you see the policies that these states are passing, especially in Florida, for an example, where the governor there said any school that did not follow the policies that he was putting in place about no mask, no vaccination would be impacted by their state funding. Now, when teachers began to die in large numbers, he tried to bounce back from that to say, well, I didn't have that authority anyway. But you put it out there, and it created a whole new kind of scenario as it relates to the healthcare issue. The other thing that is going to be a big thing for institutions when we get back to an on-campus environment is the mental health of the students who are returning. Let me say it again, the mental health of the students who are returning, and not only the mental health of the students, but the mental health of the staff and the administration. Because you're now going to have students who are coming back into this environment, in some cases who've lost both parents to the COVID. They've lost family members to the COVID. And now they are trying to navigate the setting that we're in, and it's going to be difficult because now the breadwinners are gone. The virus has impacted minorities and frontline people in a disproportionate amount of way. So what does that mean when it comes back to the campus? So one of the things that's also happening is the cost of doing business. Inflation is up. I don't know how many of you saw the caption of 60 or 70 ships off the coast of California waiting to get into the ports just to unload. That is going to be a huge problem as we begin to look at the supply chain. Even things that we order on campus in terms of supply is going to be a backlog. The whole issue of staffing is still a problem because you're having some staff people who is opting out. You're having people in the public schools as well as collegiate level saying, we will now decide not to come back to this environment. We're going to start our own business. We're going to do some other things. And so, Mr. Murphy, I would like for you to chime in, if you will, to think about what does this mean for campuses in terms of funding going forward, but also in terms of maybe some of the facilities and student support issues.
Yeah, absolutely. There's, as you probably all know, pending in the Reconciliation Act that's before Congress now, if it ever gets through Congress, Joe Biden's Build Back Better plan, is a significant amount of money that's set aside for HBCUs, for in the way of student support, scholarships. There's research related stuff that's pending in that legislation that would be certainly helpful to certainly our institutions. So what we see is that, with respect to campus facilities, et cetera, I mentioned the fact that we got to keep those, the concern is keeping the campus free and clear of the virus. There's also concerns about, what kind of facility we need, or facilities we need going forward with this, the impact of the pandemic. There's those considerations that's in place now. Some institutions, some of our clients have actually grown their enrollment quite even a higher level than it was pre-pandemic. And so they don't have necessarily the issues of whether we've got too much facilities now that things are different, maybe that we're looking to do more online education than traditional education. You know, those are some of those issues that are currently underway and under serious consideration is what will we look like going forward in this pandemic environment? Because as I said earlier, it's going to be here for a while.
Thank you. One of the things that early on too, I don't know if you all recall, but we had Dr. Bell Willen on one of our broadcasts last year, and we're talking about the impact of the pandemic in terms of accreditation. And one of the things that we were very pleased to see was the quick action that at least the Southern Association took in terms of granting institutions the right to move to an online platform, even if they were not authorized to do so. But hopefully they have circled back now and followed the necessary protocol to get that extended. But again, that was a real-time situation that we saw where the accrediting agency realized the impact of the virus potentially on these institutions, and they made quick decisions to facilitate the online learning. They also moved their protocol in terms of visits and monitoring from face-to-face to an online platform. And so I was very pleased to see that as one of the outcomes. Now what we're looking at is we still have, from a teaching and learning perspective, again, there were many, many teachers who had not been properly trained in terms of online teaching. And so in some cases, what I would have want to have seen is that some of those funds would have been used for faculty development in order to get some of these teachers up to a level where students would not suffer in the teaching and learning process. I was speaking to a colleague of mine who is a provost, and they have, I think it's a Blackboard system, where anyway, they could monitor classes in terms of when teachers sign on, not that they're trying to spy on anybody, but they were looking at the impact of the virus in terms of when classes are going to be administered and what have you. And in one case, they had several professors who had not logged on, and they were almost half of the year was gone. That's an impact on learning. The other thing is that there are data to show that the digital divide is real, and it impacted many of our low-income students in a way that put them behind, because many of the students would use institutions' facilities to go to the lab, to get the use of computers, to do work. And now that they were home, they could not access the hardware or the software. I guess what I'm saying in a nutshell is that the challenges in higher education have not changed during the pandemic. The pandemic just exacerbated those challenges. So now you're still dealing with issues of affordability. You're dealing with issues of diversity and inclusion. You're dealing with federal funding and other sources of funding. We're looking at situations in which campus activism may have been highlighted a little bit, but because the on-campus scenario was not there, they were spared in a real situation, because I really think that had the virus run its course and we were back on campuses, that you would have seen a lot of campus activism around the George Floyd issues and the other untimely deaths of Black males and other unarmed Black people around this country. I don't think the campuses were prepared to deal with that. So it's almost like a delayed activity, if you will, because folk are not there gathering. Even though we see a lot of online chatter, the physical presence is just not there. The other thing that we see as it relates to the digital divide is the bandwidth. Some of the students who have access to Wi-Fi, they just don't have it in a sustained way that they can engage in learning. There's been reports put out by the Department of Education that chronicles the number of students who have just been dropped by the wayside. And that is very, very disconcerting. One of the things that you're going to have to kind of figure out on your campuses is how do you continue to engage students through the student support portal? Because just because the pandemic is here and just because there's online learning, it does not decrease the need for student support in terms of tutoring, in terms of mentoring. And one of the big populations that are being impacted more so than others are students with disabilities, learning disabilities. And so what we're going to do now is kind of stop here and see if you have questions. Some questions came in. I'm going to ask Ms.
Pete, before you go to the questions, you mentioned earlier in your remarks that we had Dr. Bell Whelan with us. She's also in this webinar, and maybe want to shed some insight on the accreditation process.
Okay, I didn't realize she was on the screen, but that's good. Yes, if she has some things to say, she's more than welcome. Yeah, Dr. Whelan.
You're too kind. Thank you very much.
No worries.
I had put a message in the chat that the Department of Education gave us permission to extend deadlines and go to virtual visits and things like that. That's not something that we did by ourselves. And so I wanted to give the department credit for that. And all accreditors were given that permission, not just SAC-COC. I sit on with a group of what we used to call regional accreditors, and it was interesting to listen to all of the changes that have gone on. Just about everybody's gone to a virtual format, though interestingly enough, the last time the Higher Ed Act was reauthorized in 2008, there is a provision there that even if we have virtual visits, that we have to have an on-site follow-up. So because of the size of our region, we are at about 165 follow-up visits that we have to do at some point. So there's never a dull moment here. I'm very excited on the way our institutions responded to the pandemic. And yes, Pete, some of that money was used for training for faculty to get them up to snuff on how do you teach a class online. As well as to form partnerships with either companies or other institutions that were offering distance learning programs already, to say, help, I've never done this before, what do I do? So anybody who says higher ed, is not innovative and can't respond quickly, doesn't know what they're talking about.
Yeah. Derek, thank you for pointing out that Dr. Whelan was on the screen. I knew that there was a possibility that she would be here, but I know also she had a very busy schedule today. And so Dr. Whelan, it's always good to be in your presence.
Ditto.
And thank you for those timely comments. Let's open it up to questions. Dr. Howard Patisse, I know you got some earlier questions, and if you can fuel those questions to us, we'll be more than happy to take them on. Okay.
Absolutely. Thank you so much, Dr. Silver and Mr. Murphy, for that introduction of really thinking how we can pivot, how we can cope, and really strategize moving forward. So these were a couple of questions that were submitted by our viewers ahead of time, so we want to get to those. So the first question is, how are private and public funding distribution faring among HBCU, community colleges, BBCUs, public universities, and how are HBCU private universities really doing since March of this year, 1 year after the pandemic?
Well, Mr. Murphy, you want to take that one?
Yeah, absolutely. Well, what I've seen here is that those institutions that were really fiscally struggling before the pandemic, most of the money that they used with this stimulus money that came through the federal coffers were used to basically stay afloat. However, there were some of our institutions, or some of the institutions that I've seen, particularly private HBCUs, who were financially sound. This month, they were, those institutions were able to program these resources to really improve to deal with specifically with the additional costs of the pandemic, right? But also to start looking at other ways in which they can utilize this money to sustain their institutions. So it's really a mixture, depending on how strong the institution was going into the pandemic versus where they are now.
I think also there were some problems early on in terms of processing the money to these campuses. I see several college presidents on this line today, and if any of them want to chime in on that, we'll be more than willing to listen to them, because it was accessing the money and having local banks to process the money coming to the institutions. And some of the institutions were behind the 8 ball in terms of getting some of the money to affect change at their institution because the local lending institutions didn't have them on their radar screens. I don't know if anybody who's online want to address that, but that was one of the things that I saw. So you can speak up if you want to on that one. The other thing that I'm trying to challenge institutions that I have conversations with is how do we begin to have a new business model? How do you begin to have a practice that would not put you in the situation that you were in prior to the pandemic? And what I'm simply saying there is that there has been a forgiveness of loans. Some of it's 23 million, some of it's 56 million, 86 million. So when you began to think about the debt service on that money, those are hundreds of thousands of dollars freed up on a monthly basis. What have you decided to do to enhance the institution in terms of forward thinking, because this cash flow has been freed up? Now, what I've heard some institutions say they're going to do is get right back in big debt. Well, that's their business if they do so, but they need to begin to look at the longer term financial stability issues and how do you sustain going forward. Here's another question.
Thank you, gentlemen. The next question is, what are your thoughts on in-person versus virtual annual conferences in terms of the planning process? As you all stated, knowing that that the pandemic, or at least COVID in its current form, will be here for a while.
Well, I'll start off and then hand it off to Mr. Murphy. I think that in any decision that is being made, the health and safety of the constituents should be first and foremost. We know that a lot of organizations depend on these conferences to make sure that they have enough revenue to operate themselves. But what we've seen during the pandemic is that many of these entities have gotten so innovative that the online conferences are just as good or better than the face-to-face conferences, and they are attracting more people. And so this morning I just finished a 3-day international conference with the Association of African Universities. Just recently appointed the chair of the North American Association of African Universities. And we did this whole thing virtually, and we had more people participate. What we did is reduce the price a little, but the quality was not compromised at all. But I do think that if you're talking about in-person versus virtual, I think the health and safety of the participants should be the paramount decision point. And then, of course, looking at how you can maintain the quality in that regard. Mr. Murphy, you may have some thoughts on that.
Oh, ditto on that. I know we normally do an annual conference ourselves for HBCUs, and this past year, or this past March, we had the most amount of attendees because it went virtual than we've ever had before, and the quality was even better than the in-person type. So yes, indeed.
The last part of the question had to do with the impact on college presidency vacancies. I think you have to be wired differently anyway to be a college president. And now that these challenges are on these campuses, you really need the right leader at the right time. So I think that you're going to need some people in these seats who are transformational leaders as opposed to transactional leaders. You're going to have folk who can think out of the box, folk who can not only raise funds and raise money, but also think about new partnerships that they can have on behalf of their institutions. So I think that anyone who's up for a challenge, the pandemic will be there for them. We see a lot of college presidents retiring in the last 18 months. I don't know if it had to do with the pandemic or if it had to do with age or it had to do with I just got enough. But the bottom line is I still see that there are opportunities for those who want to go into that venue, okay?
That's actually a perfect lead in, Dr. Silver, to the next question. Where are some opportunities where we can pivot during the pandemic? Are there any areas, disciplines, fields where you see this would really be an opportunity for growth for our institutions?
I do. I think that, and I'm not saying this because I am in the social sciences, but one of the things that we predicted a year ago is that ethnographic research and social stratification research would be something that would be very beneficial in the midst of this pandemic. I still think that is the case, because we need to begin to look at what has been the impact drilling down in terms of race and gender and class. And so those who are able to do research from a multidiscipline, cross-discipline standpoint, I think that's going to be good. I think also those who are innovative in accounting and finance, you're going to see opportunities there. Those who clearly understand the possibilities of growth and sustainability on the online platform, I think there are growth opportunities there also. Mr. Murphy, you have some thoughts on that?
Yes, I just can't overemphasize with the influx of money that our institutions have gotten from the federal government. This is a time to really be transformative type of thinking. Invest in your technology infrastructure so you can go online with your programs, et cetera. And because that's, you need to not only appeal to the traditional students, but the non-traditional student, the student that's got family or other commitments and they can't, they can only do this stuff at night or what have you, at their own particular program schedule. So that's what I would suggest out of this.
Yeah, and I think also there's an opportunity for partnerships between K through 12 and higher education, because some higher education institutions are losing staff because they don't have a real answer to how they're going to address childcare and the safety of their kids. And so, as many of you notice in Zoom calls that you've had with your colleagues, in the background, you see the children playing or studying, and there has to be an answer to that at some point. The other piece is that if there can be some safe hubs, if you will, for students to learn, because in many cases, you have families with multiple students, multiple children, and then parents who are working, and so they only have 1 or 2 devices at their house. So they can't really structure the learning and the working environment together. So a lot of staff have decided that this is the time that they're going to retire. We have situations in the public schools where there have been mass resignations, and you're now bringing in the National Guard to do tasks that normally staff would do on the campus, like bus driving and like counseling and those kinds of things. And in some places, they're using the National Guard to staff hospitals. The medical unit, the medical vacs of the National Guards are being called into different areas because they're overwhelmed with patients. And so I think that one of the opportunities, and I say this very cautiously, is moving in the healthcare area. One, because we're losing a lot of healthcare folk because of what's going on, but we also see the real need of having well-trained healthcare professionals.
One other thing I'd like to mention, Dr. Silver, is that I think employers need to be flexible about where employees work, whether it be on campus or remotely. I know with the pivoting to the pandemic in our firm, we found out that we were far more productive working remotely. And so I would appeal to employers, the institutions out there, to be open and flexible for your employees to work remotely during this pandemic and even beyond it.
Yeah, I know in my own career, I know when I first started, I was commuting from Atlanta over to Kennesaw every day for 12 years. And that was difficult in the traffic and what have you. And then as I got advanced in my career, even when I worked for Saks CLC, I live right across the street from Saks. I could walk to work if I wanted to. And now in this pandemic, right before, I guess it was in 2012, I made the decision not to invest in office space downtown and created an office, 2,200 square feet of office space in the first level of my home. And I have everything that anybody else would have. I have a conference center, I have a telecommunication center, I have a conference room, I have a break room, I have dedicated office space for those who work with us. We are more productive. As my son told me, he said, "Dad, it seems like your business is Corona proof." I said, "No, it's not Corona proof. It's just making better use of our time." Yeah. Because the time we spend in the airports, we're now spending in terms of churning out the work. And so I think what we have to do is begin to think differently, because the brick and mortar campuses, I mean, that discussion was going on before the pandemic. And now that we have experienced that we can effectively teach and learn on this online environment, it might just be the savior for some of these institutions who've been challenged with place-bound students.
That's a great segue, gentlemen, to the next question. It's really talking about an incentive-based budget model. So what do you think are the pros and cons of an incentive-based budget model?
Yeah, I'll take that one. But let's talk about what is an incentive-based budget model. And essentially, it's a way of allowing departments to achieve their goals or to work more efficiently at a reduced price or a reduced cost. So the money that is saved by how much more efficient you are operating, and therefore at less cost, you get to participate in what that is at the end of the year. So let's, for example, let's say you've got your university adopted a $10 million budget, revenues and expenses were equal, balanced budget, and at the end of the year, you ended up having $1 million surplus. Well, your department, for example, had constituted 100,000 of that. So if you saved $10,000, then you get to participate in that surplus for the year. Some of the models I've seen is like 50% of that. So you get it's plowed back into your budget. Maybe there's some equipment or stuff that you've been needing to procure for your department. Then that's the way that you get that money. Now, the problem with that is, it's a great way to reduce expenses or keep your expenses lower than what it could be, because you're incentivizing the different departmental unit heads to save and to carry out and meet your program objectives with less money. But part of that problem is, let's say that I'm the business school and I'm responsible for most of the students on my campus. So I'm a very profitable oriented business school, right? So, but if you're the accounting department and you found a way to operate for less and still get the work done, you get to participate in that money that was brought in by the business office. So, by the School of Business. So there can be confusion there. It has to be clearly spelled out in terms of what are the expectations, what are the rules, if you were to implement one of these incentive-based budget models, versus what you typically do, which is take this year's budget and plus or minus a few percentages or whatever, and that's your next year's budget. That's what probably most people do. But that's pretty much what that's involved.
Let me kind of comment on that too, because first of all, I want to say I agree with every single thing that Mr. Murphy has said. But I think in the midst of this pandemic, we need to begin to think about alternative budget modeling, period. Again, maybe some folk on FAMU's campus on this screen, but our firm have worked with them over the last 6 months, and they are doing some innovative things in the Office of Academic Affairs under the Office of the Provost in terms of rethinking the budget model. Because if you begin to think about the pandemic and the stress that it has put on institutions in general, what better time to think about aligning the budget with strategic priorities? So one of my big disconnects in higher education is how institutions respond to this whole concept of institutional effectiveness. And if you look at in the Southern Association, Section 7, one of the standards talk about the integrated model of planning, budgeting, research, and what have you. A lot of institutions get through that standard, but when you get on the ground and see what they are doing, there is no relationship between planning and budgeting. And that to me is a big fallacy. They should begin to look at the budget from a holistic standpoint, but tie it to the strategic plan and the priorities of the institution. So what it really boils down to, even before you can get to incentive budget, and I know you got to have some tough skin to do what I'm about to say, and that is you need at least 2 years of zero-based budgeting to align the budget really to the priorities of the state. And in Florida, for an example, you have situations where you have performance funding. And so you have budgets that are out of line with the matrix related to the performance funding. So if you go along that same budget path that you've been going for the last 15 years, you're going to have a negative impact on state income because you're not going to meet that matrix. So for FAMU, for an example, they had to change a lot of things, including admission standards. And for the last several years, they have been benefiting from the performance funding money. But they had to take a deep look at themselves and make that change in real time. So what I'm suggesting is that in the midst of this pandemic, with all that is going on, this might be a chance to reset how we think about the budget model and how we align budget planning with research that is generated on the institution, as well as the priorities that have been agreed upon by the board, by the administration, by the faculty and the staff.
Wow, you all have given us so much to think about. And if you can believe it, it is after 2 o'clock Eastern Standard Time. So technically we're out of time, but I know Dr. Silver and Mr. Murphy have been gracious enough to share their insight and feedback. So as we kind of wrap up, and I think about the questions that have been submitted thus far, some of the themes are around safety in terms of faculty from K-12 to higher education. You know, how do you advocate for yourself and also focus on self-care? So just your parting thoughts and words on advocating for yourself as faculty, staff, and administrators, and for your students, everything from self-care to cleaning supplies, and what we need to be doing individually and collectively moving forward.
Well, those of you who know me and have been following me for years know that one of the things I always say is take care of yourself first, whether it's a pandemic or not, because some of these institutions will use you and use you up, and then when they finish with you, you're gone. So I think we got to use common sense as we deal with these situations. As I share with you, I had a recent visit to the University of the Bahamas. They treated me very nicely, but one of the things I noticed is that their protocol was very, very strict. In terms of getting on the campus, you had to take a temperature check in the conference room where I was at. Whoever came in was at one end of the table, I was at the other end of the table. So I never felt that my body or my health was threatening. I think as individuals, you're going to have to make those hard decisions, and you have to understand what is your breaking point, because some of these institutions, unfortunately, I have another client in Florida that mandating on-campus classes and on-campus meetings. And so you're gonna have to decide what amount of risk you want to take as an individual. And some of us are in situations where we have illnesses and other preconditions that will make us more susceptible. I think safety and health should be the highest priority. Mr. Murphy, your thoughts? Absolutely, safety and health. Certainly think, not only protect yourself, but protect others by wearing your mask, and just really just some common sense sort of things that you should exercise each day or as you interact with others. Well, let me just say in parting words, let me put on my political science hat. I see some of my fellow political scientists on the screen today, but this whole argument against about my rights versus your rights, you may have the right not to be vaccinated. You may have the right not to wear a mask, but if your rights infringe upon other folks' rights, then I think that's where the line should be drawn. So my concern is, and I know some people may disagree with me, but We can disagree without being disagreeable. My biggest concern with the unvaccinated and the unmasked is this. They exercise their right, and then when they come with that 90% plus number in the hospital and that 95% number that are dying from the virus, they are exposing the frontline workers who are caring for them. So my thinking is, if you think that the virus is not so important that you don't have to be vaccinated or that you don't have to wear a mask, and I'm not trying to be uncivilized or not humanizing this, but why then are you rushing to the hospital to put other people at risk? If you really believe that that's your right, then stay home and deal with that, but don't put other folk at risk. So as we close, I want to say to each of you on the screen to take care of yourself. Make sure that you are doing what you need to do. I'm also hoping that somebody's on the screen that can talk about the career webinar that's coming up, because I'm sure that some of this is going to be addressed in terms of how do you maintain a career in the midst of this pandemic? How do you change your career in the midst of this pandemic? And what are the pluses and minuses? So let me say in closing to Dr. Howard Baptiste, thank you for spearheading the moderation of this and using your platform there at the University of Tennessee, Chattanooga. Thank you very much.
Thank you so much, Dr. Silver and Mr. Murphy. You have given us much to chew on, to take back to our respective campuses and classrooms. And so I think there are so many questions. We might talk offline to think about a part 2 session to the information that you all have shared thus far. Just as a reminder, we have 2 upcoming events through AABHE that we're really excited to share with you all. On Wednesday, October 27th, we have a research webinar with a number of key researchers and facilitators in our organization that will be providing a lot of really good insight and information about how to update and increase your research profile. That's a free event, so we will drop that link in the chat so you can register for that event. And we also are offering a career expo, which is on Friday, November 12th. And we can put that information in the chat as well. That does have a fee attached with it, but trust me, that is not an event that you want to miss. Dr. Shante Bolton at Washington University is going to be leading a series of webinars and workshops to really think about what these gentlemen have said today, which is how do you pivot and move forward in your career in the midst of a pandemic. I'm going to turn it over to Dr. Rivaris, the president for AABHE, for our closing remarks. And again, thank you all so much for attending. We're going to share also a survey link with you to provide feedback about your experience this afternoon and more information about how to become a member. We'll also include the YouTube link for this webinar as well. So thank you so much, Mr. Murphy. Thank you, Dr. Silver, as always. And I'll turn it over to Dr. Rivaris.
And I want to echo the gratitude to our presenters, Dr. Silver and Mr. Murphy, the great information that was shared, our buddy Belle Whelan for jumping in and providing some additional insight. And of course, Shawani and the University of Tennessee, Chattanooga for hosting us. You know, Pete, I get upset when I think about people who choose not to get vaccinated and then will want to tax the resources of our hospitals, not just the infection that they present, but there are people who have died, who have been denied medical service because those who chose not to get vaccinated were being treated. And so there's a whole lot beyond the political. There's some real, you know, just some poor understanding of what it means to be a society and what it means to be community that's been executed. None greater than the lovely and talented Miss Nicki Minaj, who, you know, decided that she doesn't have enough research on this topic, but I'm really waiting to see what her research looks like. Anyway, I thank you all for your real research and your real insight on this topic. And to those who have joined us for the first time, as was mentioned, you'll receive some information, some additional information about the organization. We'd like to have you come and join us for our October 27th activity, our Career Expo. We've got a conference coming up in March and so much more. So please stick with us, join us again and again, and we'd be glad to support you in your initiatives as well. So on behalf of the board, I have several board members with us, several other members of the organization. On behalf of the American Association of Blacks in Higher Education, we bid you adieu and wish you a great rest of your afternoon.
Thank you so
much. And Derek, before we go out, let me say this, thanks to Mr. Murphy and the Wesley Peachtree Group. You all should try to seek him out. I mean, he is an innovative finance guide. So make sure you seek him out. The other thing is that Mr. Murphy and myself and others put together this white paper on finance as it relates to this. So we're going to try to make sure that everybody who tuned in today get a copy of that white paper. We'll provide that link maybe afterwards, Mr. Murphy, and make sure that those individuals who we want to see who came to the webinar before we distributed that. So that's one of the bonuses that you're going to get. And you're going to get some very innovative thinking from his staff and my staff on that particular issue. Thank you. Goodbye, everybody.
Bye now. Thanks.
Thank you, everyone.
Thank you.
Thank you all.
Good to see so many of our friends, and you guys are doing fine.
Hi, Pete.
Hey there, the Flukers. How y'all doing? Love you guys. Mwah.
Love to you,
We
man.
got it.
We do a virtual hug.
Look forward to seeing you soon, Pete.
Beautiful.
Yes. Thank you.
I love the
Thank
face.
Good
I
afternoon.
see
Dr.
Miss
Silver.
Silver Parker from the Silver Parker group is on. That's great to see her. Yeah, good hug. Yeah. Fantastic. Dr.
afternoon,
Sehu, how
Dr.
you
Silver.
doing?
Hi,
Yes.
Dr. Silver. Really great seminar. Thank you, sir. Thank you for
Thank
what
you.
you do and how you help all of our, institutions.
Well, thank you. It's a blessing.
Absolutely.
I see an LMI legend, Brother McWayne joined us.
Yes, my son from another mother.
Yeah.
How y'all doing?
All right, man. Good to see you.
The legendary Dr. John A. Brown
Johnny
is on.
Brown. Yes, indeed.
Yes, a great K through 12 legend there. We appreciate you coming in.
Hey, thank you. An outstanding job, everybody.
Thank you. Well, we're glad to be of service. And I just want you to know, Mr. Murphy, how much I appreciated having the opportunity to share this screen with you today. You're an awesome guy, and your firm is doing a lot of good stuff for institutions. And that's why I wanted to make sure they know who you are so they can partner with you going forward.
Thank you very much. And it's just been such a pleasure to share the same with you, sir.